How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, no, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was, Ballinstone. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
About the work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.
Good afternoon, colleagues. Before we begin, can I remind all members, as always, to be careful about observing social distancing rules within the chamber and within the Holyrood campus. We're going to turn now to First Minister's questions, but before we begin with questions, could I invite the First Minister to give us a short statement? First Minister.
Thanks, Presiding Officer, and I will begin with a brief update on the key statistics in relation to COVID-19. Since yesterday, an additional 12 cases have been confirmed through NHS labs. That takes the total number confirmed in that way to 15,665. A total of 987 patients who are either suspected or confirmed as having COVID-19 are currently in hospital. That's a decrease of 24 since yesterday, and the number of confirmed cases within that decreased by 18 since yesterday. As of last night, 18 people were in intensive care with confirmed or suspected COVID-19, which is a decrease of 3 since yesterday. I am afraid that in the past 24 hours, 12 deaths have been registered of patients who had been confirmed as having the virus, and that takes the total number of deaths in Scotland under that measurement to 2,434. National Records of Scotland, however, has just published its more detailed weekly report, and these figures report deaths where COVID has been confirmed by a lab test, and also those where the virus was entered on the death certificate as a suspected or contributory cause of death. The latest NRS report covers the period to Sunday, the 7th of June, 3 days ago, At that point, according to our daily figures, 2,415 deaths of people who had tested positive for the virus had been registered. However, today's report shows that by Sunday the 7th of June, the total number of registered deaths with either a confirmed or presumed link to the virus was 4,000. 89 of those deaths were registered in the 7 days up to Sunday. That's a decrease of 42 from the week before, and it is the 6th week in a row that the number of deaths from the virus has fallen. It is also the lowest number of COVID deaths in a single week since late March. The total number of excess deaths, which is the number above the 5-year average for the same time of the year, also decreased from 111 last week and from 878 in the peak week for excess deaths to just 37 in the most recent week. Deaths in care homes made up 47% of all deaths linked to the virus last week, which is down from 53% in the previous week. And the number of COVID-19 deaths in care homes also reduced again from 69 to 42. Now, all of those figures, especially that total of 4,000, are far higher than any of us would wish. And I know that a downward trend in numbers doesn't console those who've lost loved ones to the virus, and my thoughts and sympathies are with all of them. However, the weekly number of COVID deaths has now fallen, as I said, for 6 weeks in a row. Today's figures are less than 1/7 of their peak level. Excess deaths are at less than 1/20 of their peak level, and deaths in care homes are also now falling. That progress is significant, but we must take great care now to ensure that it is sustained. If it is, I hope that next week we will be able to announce some further, albeit careful, changes to lockdown measures. Health Protection Scotland have also published some very initial data today, Presiding Officer, on our Test and Protect system. This data will become much more detailed in the weeks ahead. However, today's figures show that between 28th of May, when the system launched, and the 7th of June, 681 cases were reported where the individual tested positive for COVID. Contact tracing has already been completed for 481 cases and will be ongoing in others. And in total, 741 contacts have so far been traced. Now, I would remind everyone watching that if you have symptoms of COVID-19, you should book a test immediately and follow the advice on self-isolation. And let me close, Presiding Officer, by emphasising the other key elements of our guidance. We should all still be staying at home most of the time and as much as possible. Life should not feel normal at present. We mustn't meet more than one other household at a time, nor more than one a day, and we must keep to a maximum of 8 people in a group. When we do meet people from another household, we must stay outdoors and 2 metres apart from them. We should all wash our hands often and wear a face covering in shops or in public transport. And above all else, we should all remember that the decisions we take as individuals affect the well-being of all of us. So let me thank everybody across Scotland for continuing to do the right thing, because it is making a difference and we are all saving lives.
Thank you very much, First Minister. Now, before we turn to First Minister's questions, just encourage all members who wish to ask a supplementary today to press their request to speak buttons, and I'll take all the supplementaries after question 7 from Sarah Boyack. Question number 1, Jackson Carlaw.
Presiding Officer, later this afternoon, the First Minister is expected to publish figures on care home testing, and today's figures again confirm that with a majority of lives still being lost in our care homes, how important it is. So we know testing is vital. That's what the World Health Organization has said for months, and it's also what we've all said repeatedly in this chamber. But we also know that many care home workers and residents are still waiting for a test, never mind a routine one. The promise to test them all was now made 3 weeks ago, and I wonder how much longer the First Minister thinks they will have to wait until they receive it.
First Minister.
Well, we will publish figures later on today. They will be very initial data. Again, it's data that will become much more detailed over the weeks to come. And even the initial data, though, that we publish today will be broken down by Health Board, and the figures will be published in detail later, but cumulatively to the 7th of June, these figures will show that more than 11,000 members of staff have been tested, more than 15,000 residents in care homes. So this work is underway. The Health Secretary and I have been very clear that we want to see Health Boards accelerate the progress, and that's why publishing data Health Board by Health Board will allow us to track that progress and indeed the public to scrutinise that progress. It is important, and I think this is a key point, that we do establish this testing on a very sound and sustainable basis. I certainly want to see progress accelerate, but more than anything, I want to make sure that it is happening in a way that we can sustain over a period of time, because this is testing that will happen regularly. It is not, as I understand the position, it still is, although I'll be corrected if I'm wrong about this, in other parts of the UK, one-off testing. It is testing that will happen on an ongoing basis. So it is right that health boards make sure that they carry it out quickly, but also carry it out sustainably, and that is the work that is underway.
Jackson Carlaw.
Well, it may be a commitment to routine testing, but it's that first test that is still to take place. And with over 50,000 care home staff, 11,000, while welcome, is still well short of the promise made 3 weeks ago. The fact is that ministers need to get a grip of the situation. They need to do it now. The time for promising is over. It's long past time to fully deliver. So a simple question. Will the First Minister today commit to setting a hard deadline for delivering those initial tests for both residents and staff in care homes?
First Minister.
We will certainly consider doing that. Some of the data that we are receiving from health boards still has to be validated, and it's important that when we publish data, it is robust data and validated, and then we will look to see whether that is appropriate. But I would make the point again that this will be ongoing testing that has to be done week in and week out for as long as we are continuing to live with this virus. And we're not doing it, again, this is not a point of criticism, it is an observation. We are not simply doing it by posting out testing kits to care homes. We are doing it in a way that is robust and sustainable and can be supported on that ongoing basis. I would also say that in relation to the comments about get a grip, we are now seeing albeit in a situation that has been incredibly challenging and continues to be challenging. We're seeing the numbers of care homes with an active outbreak of COVID-19 reducing. We are seeing the number of cases, new cases reducing, and as I've just reported, we are seeing the number of people dying in care homes because of this virus now reducing rapidly and on a sustained basis. Now, what that says to me is that the actions that are being taken in care homes to protect older residents are having the effect that we want them to have. But of course, as we move through the exit from lockdown more generally, it is important that we have the right measures in place on an ongoing basis. And testing is not the only one of these measures. I've already said before in this chamber that we must be careful that we don't put all of the focus on testing, particularly when we're talking about testing asymptomatic people. But it is a key measure, and that's why doing it quickly but also sustainably is so important.
Jackson Carlaw.
Presiding Officer, this is about people on the front line, and without a vaccine, care homes full of the vulnerable will always be at the heart of the proactive strategy that we need to pursue on coronavirus. And to take one example, we learned yesterday that NHS Borders is now telling the Scottish Government it doesn't have the capacity to carry out tests in care homes within its area. Care home owners in towns like Castle Douglas say none of their staff have been tested, unlike those in England a few miles across the border. And we learned yesterday from Scottish Borders Council that locally they have only received 480 testing kits to cover all 1,200 staff in their local care homes. Can the First Minister explain how it will be possible to test all care home staff when health boards are given fewer than half the number of test kits they actually need?
First Minister.
Care homes, through health protection teams and health boards, will have the resources they need, whether that is the human resources or the resources in the form of testing kits. The Health Secretary, in fact, I think she said this publicly already this week, had a conversation, as she does regularly, with Health Board Chief Executives, I think on Friday of last week, and no concerns were reported then about lack of resources to do this. So the resources are in place, both in terms of the kits that are needed for testing, the resources that are needed to take the samples, and crucially, of course, the laboratory resources that are needed then to process those samples. That's the work we've been doing in recent weeks to build up that capacity. So the resources are there. It is now a case of making sure that the job is done quickly, but it is also done in a way that is sustainable. And it's not simply about reporting numbers of test kits posted out. It's also about making sure the tests are done and that they are done not just on a one-off basis, but on an ongoing basis, week in and week out.
Jackson Carlaw.
Presiding Officer, this promise 3 weeks ago was not one that was lightly given. Why are we still hearing about problems with testing 3 weeks after the Health Secretary promised it would be sorted? Why is the story we hear in the daily press conferences in Edinburgh so different to what we're picking up on the ground where it matters. Why did the Scottish Government say it would test all care home workers repeatedly on May the 18th and then take until June the 7th to write to NHS boards asking to get it sorted? Why are letters being sent out, not testing kits? I ask, if the First Minister is confident about this, then she should set out a clear timetable and a clear deadline for the first round of care home tests to be completed. This is her chance. Will she now take it?
First Minister.
What certainly happens reliably week in and week out is that Jackson Carlaw makes unsubstantiated claims about the handling of the COVID-19 outbreak. What happens week in and week out is that I, the Health Secretary, and the entire Scottish Government gets on with the job of tackling this outbreak, which is partly, together with the collective efforts of people the length and breadth of the country, that we are now seeing cases decline, numbers of people in hospital decline, number of people in ICU decline, number of people dying, including in care homes, decline. That is the progress that we are making. Now, I'm not sure how much Jackson Carlaw knows or bothers to find out about how these things actually work on the ground. But when we say that 50,000 staff of care homes have to be tested, of course there has to be a programme of work over time to make that happen. The processes have to be put in place and the resources which are in place have to be put in place. That is work that is ongoing. We will see that in the data that is published later today, and then we will see the progress on that week in, week out as we publish that. And that will show that this government is getting on with the job of tackling this virus, which is exactly what people across the country want to see happen. What I don't think they want to see happen is politicians engaging simply in party politicking, which is what Jackson Carlaw does.
Thank you. Question number 2, Richard Leonard.
Thank you, Presiding Officer. The marked decline in the number of deaths to COVID-19 gives us hope, but we should never forget the lives lost and the families left grieving because of this pandemic. As we look to the future, safely restarting NHS services is a national priority, but our NHS is stuck. The restart of services cannot begin without being sure that our hospitals are safe. We now know that there have been almost 1,800 suspected cases of hospital-acquired COVID-19, which again raises questions about PPE and testing. Families and NHS staff need answers. Now, we understand that a Scottish Government review group is examining the data, but families who lost loved ones as far back as March and April feel that this process has been too slow and too secretive. So, for the sake of public confidence, ahead of the reopening of our NHS, will the First Minister agree to publish details of this group's work, including its minutes, all of its recommendations, and will you agree to appoint an independent chair to urgently review that work?
First Minister.
Can I say, first of all, in relation to Richard Leonard's first comment, that I absolutely agree with, that we should never forget the human lives lost behind the statistics that we report on every day. And I, speaking personally, never ever will. Every one of these numbers I've had to read out on a daily basis will be engraved on my heart for forever. And I think that will be true of all of us. I would also say our NHS is not stuck, to use Richard Leonard's word. Our NHS is currently preparing remobilisation plans so that it can safely, but as quickly as possible, resume services that had to be postponed during the COVID crisis for reasons that I think everybody understands. Turning now to the issue of nosocomial infection that may be acquired in hospitals. Let me be very clear that the Health Secretary has been very clear about this. We have published unvalidated data, and we did that in an attempt to be open and transparent about the data. Let me just say as an aside, no equivalent data has been published yet for any of the other UK nations. But it's very important that we understand the limitations of that data before it is validated. It would be wrong, and I note the fact and welcome the fact that Richard Leonard said suspected, because it would be wrong to say that these are all infections that we know were acquired in hospital. Many of these infections may well have been acquired in hospital, but it is also possible, given the incubation period for this virus, that some of them were acquired in the community, but only diagnosed when a patient or a member of staff was in hospital. So it's very important to understand that. There is a process now underway to validate that information. NHS Scotland works to apply the European Centre for Disease Prevention and Control international case definitions for hospital-associated COVID-19, and when that work is complete and that information is validated, it will be published in a validated form. As the Health Secretary said, we hope that that will be by the end of this month, and it will be published. On the issue of the nosocomial review group that was established in the early part of May, it's an expert group. It's currently chaired by Professor Jackie Riley, who's the Nurse Director and Healthcare Associated Infection Executive Lead at NSS, and I think that's an appropriate chair for that work. It's looking at a range of things. One of the things that is looking at just now is the extension of routine testing, such as we've just been talking about with care home staff, to frontline NHS staff, and it will also be developing further proposals and recommendations to make sure that everything possible that can be done in hospitals is being done to reduce the possibility of hospital-acquired COVID-19. And of course, we will look at what we can publish from that work and make sure that its recommendations are publicly known, so that we can be very clear about how they are being taken forward.
Richard Leonard.
I thank the First Minister for that answer, but I know that many families and NHS staff will be disappointed that the First Minister is not prepared to consider the case for greater independent scrutiny of what's happened. We first called for an NHS recovery plan 5 weeks ago, and when we did, we called for a guarantee of access to both testing and PPE for all NHS and care workers in every part of Scotland. And I thought that the First Minister agreed. And today again we have been told that phase 2 of the easing of the lockdown is likely to start as early as next week. However, the Health Secretary admitted in Parliament just yesterday that there is still no plan for testing NHS staff, and there is still no plan for the standard and supply of their PPE across different NHS settings. I've been raising workers' concerns about PPE since March, and we know that as far back as 2018, Exercise Iris concluded that, and I quote, "Amongst frontline staff, there is unease at the lack of clarity on PPE availability, training and testing." 2 years on from that planning exercise, and now the pandemic is real, that unease remains. Staff tell me that their PPE is suboptimal, and that they are still being instructed to use PPE which is out of date, including critical equipment like FFP3 respiratory masks. Can the First Minister give a guarantee to NHS and care staff that PPE guidance and supplies will be enhanced, that out-of-date PPE equipment will be withdrawn immediately, and that regular and routine testing will be rolled out without further delay?
First Minister.
It's true.
Really important issues, so I want to take them one by one. Presiding Officer, I'll be as brief as possible, but let me start with PPE. There is very clear guidance in place, actually across all 4 UK nations, on the circumstances in which PPE should be used. That guidance was informed by clinical groups and expert organisations, and ultimately that says that any member of staff, if they themselves, not government, not their bosses, but if they themselves risk assess that they should be using PPE, then they should use PPE. We have also been working extremely hard to make sure that we have adequate supplies of PPE. At no point during this crisis has Scotland run out of any pieces of PPE kit. In fact, we've been able to give mutual assistance in some respects to England. So we've ensured those supplies, and we work to make sure that the distribution lines are as quick and effective as possible, and we've put in place additional distribution lines, not just for healthcare workers, but for social care workers as well. We've also been building, thanks to the work Ivan McKee has been leading, a domestic supply chain for PPE, so that we've built greater resilience into that for the future. On this issue about expiry dates, again, to be very clear, because we've covered this before on several occasions, the only circumstance in which PPE that has gone past its expiry date should be used is if it has been revalidated by the relevant authorities as being safe to use. If that hasn't been the case, then it shouldn't be used. So all of these arrangements are in place. The Health Secretary speaks to trade unions on a regular basis, and if there are any concerns, they are raised there and they are acted upon. On testing, in his first question, rightly and properly, Richard Leonard asked me about the nosocomial review group and said that it was really important that was independent, expert-led, and that we listened to its recommendations. In my answer, I said one of the pieces of work it was looking at right now and about to give us recommendations on was the extension of routine testing to frontline healthcare workers. But his second question seemed to think that I should disregard all of that and take that decision regardless of what the nosocomial review group says. We will continue to be clinically and expert-led in these decisions, and when decisions like that are taken, we will make sure the resources and the processes are in place to implement those. That's the responsible way for any government to deal with a crisis situation like this. It's the approach we've taken so far, and it is the approach we will continue to take.
Richard Leonard.
Thank you, Presiding Officer. Well, I'm bound to say that with 10,000 tests going unused daily and with new stocks of FFP3 masks due in the next few days, it's disappointing that the First Minister can't give a firmer guarantee. First Minister, I began by saying that safely restarting the NHS is a national priority. NHS lockdown has resulted in thousands and thousands of patients going without treatment, at least 80,000 alone waiting for surgery. Many are waiting anxiously. Many are waiting in pain. So we will need to use every available resource to get people booked in for procedures, taking social distancing measures into account, putting safety and saving lives first. People want guarantees that they are going to be treated in a COVID-free space. One resource not yet used but readily available is the £43 million NHS Louisa Jordan. So can the First Minister today update us on her plans for the NHS Louisa Jordan? Will the lease be extended? And if so, what role does she see it playing in easing pressure as the National Health Service begins to restart in the weeks ahead?
First Minister.
Let me come on to the NHS Louisa Jordan directly in a moment. Before I do, I just want to, I suppose, expand or close off the first part of Richard Leonard's question. He asked me to give a guarantee about testing, routine testing, because symptomatic NHS workers already have access to testing, but routine testing of NHS workers. If the nosocomial review group recommends that, I give a guarantee that we will implement that recommendation. But we will do that on the basis of expert advice that we have asked for. And I hope Richard Leonard would accept that that is the right and responsible way to proceed on matters like this. On the NHS Louisa Jordan, let me say, first of all, I am absolutely delighted and relieved that we haven't so far had to use the NHS Louisa Jordan, because had we required to do that, that would have meant that the existing capacity, including the surge capacity of our hospitals, had been overwhelmed, and that would have meant lots more people becoming ill and, undoubtedly, lots more people, even than has been the case, dying. So we should all be very thankful for the fact that it hasn't had to be used so far. We will ensure that the NHS Louisa Jordan is there for as long as we may need it, and I can confirm that as part of the remobilisation plans, we are looking at whether and to what extent we could use the NHS Louisa Jordan to do some elective treatments. Now, we've got to be careful in the judgments we make about that, because if, and I fervently hope this is not the case, and we are doing everything possible to try and avoid it, but if we face an autumn-winter resurgence of coronavirus, we need to make sure that those facilities are there to deal with that. And that goes for the overall NHS capacity that we have. We have to make sure we are protecting some capacity to deal with any surge in the virus while getting the NHS back to normal. But the NHS Louisa Jordan is part of our considerations, and the Health Secretary will keep Parliament updated.
Thank you. Question number 3, Alison Johnstone.
Thank you. I welcome that Scottish Tories and Labour have joined me in calling for regular testing in hospitals. More importantly, though, workers on the front line have long been asking for this to happen. Today, we have front-page reports that nurses are angry and demoralised about the spread of the virus on their wards. This week, yet another senior physician in a Scottish hospital has contacted me expressing dismay that people are being allowed to walk around hospitals spreading the virus without knowing it. We now know that patients and staff have been infected with COVID in hospitals, and many have even lost their lives as a result. In April, experts told us that regular testing could reduce transmission in hospitals by up to a third. Does the First Minister know how many lives could be saved if we followed this advice? And will she tell us when her government will introduce regular testing in hospitals?
First Minister.
Well, as I've just said to Richard Leonard, the nosocomial review group, expert-driven, is looking at that issue, and I hope will give us recommendations on that quickly, and when they do, we will implement those recommendations. It is right and proper, in my view, that we continue to take clinical advice about testing for two reasons. Testing, and any clinician will tell you this, from an ethical point of view, there has to be a purpose to the test you carry out on people. And secondly, and I've made this point repeatedly, that while we still have concerns about the relative, and I stress relative, reliability of the test in asymptomatic people, then we don't want to inadvertently suggest that testing is the only thing that needs to be done to reduce the risk of transmission of the virus. And that is particularly true in hospitals, where with all infections, not just this one, it is infection prevention and control measures that are most important. And they are taken extremely seriously by all health boards and in all hospitals. And the last point I would make to Alison Johnson is the point I made, I think, to Richard Leonard about the unvalidated statistics that have been reported about the possibility of hospital-acquired infection. We do not yet know whether those were infections acquired in hospitals. I would expect that there will certainly be hospital-acquired infection, but it is really important that we recognise that that information is not validated, and because of the incubation periods associated with this virus, some of those infections could have been acquired in the community. So let's be very careful when we're talking about these things, so that we are actually dealing in facts, not in supposition, which I think is particularly important given the severity of the topic that we are discussing.
Alison Johnson.
Thank you. The First Minister referred to infection prevention and control methods, and one of these, of course, is routinely screening health professionals working in hospitals for other diseases. But there does seem to be a worrying lack of urgency with regards to testing for this potentially life-threatening disease. Now, for some time, the Scottish Government has resisted the principle of testing individuals without symptoms, arguing that the test itself only works in a window of symptomatic people. Yet over the last month, testing has been expanded. I warmly welcome this. And most critically, regular testing of care workers has, in theory at least, begun. But this morning it emerged that the only reason this was introduced was because SAGE, the UK Government's Scientific Advisory Committee, recommended it. The Scottish Government's own Scientific Advisory Group, even though they began discussing this issue in early May, have not yet delivered advice, and we're told it's still weeks away. So does the First Minister have advice that the science which supports regular testing in care homes isn't relevant to our hospitals, because the testing capacity is already in place to do it? Or is the First Minister waiting until the UK Government advises her to do it?
First Minister.
I'm actually not sure I followed the thread of that question. I wasn't sure whether Alison Johnson was criticising us for following advice that comes from SAGE or not. We take advice from SAGE. We also have our own advisory group which feeds into SAGE, and it gives us advice. And as I've spoken about on several occasions today, particularly on the issues of hospital-acquired infection, we have the nosocomial review group that is looking at the various issues associated with that in particular. So we follow all of that clinical advice. And can I just say very clearly, I mean, Alison Johnson says I have resisted, or we have resisted, the principle of testing asymptomatic people. This is not about a principle. This is about practical efficacy and effectiveness. And it is the case that experts will continue to say, even today, that the test, relatively speaking, is less reliable in people who don't have symptoms. And therefore, my concern all along is if we focus all of our efforts on testing, even if we know that in some cases it is giving false assurance, then we take our eye off the ball of the other things, perhaps the more important things that need to be done to minimise the risk of transmission, particularly in institutional settings like hospitals and care homes. So we take a range of scientific and expert advice, and I'm not sure that anybody should be criticising us for doing that. And at times, waiting for that advice means that we don't rush to make announcements that then prove not to have been the right announcements. We take time to make sure this is done properly, because it needs to be done for the right reasons and on a sustainable basis. And that's what the Scottish Government will continue to do, and that's the careful approach we will continue to take to all aspects of handling this virus.
Question number 4, Willie Rennie.
We are facing a tidal wave of job losses. 1 in 10 workers could be out of a job this year. 700 under threat at Rolls-Royce and Renfrew, 200 at the Crieff Hydro Group, 80 at Fishers and Perth, 70 at Donenlow and Angus, 96 at Mignetti and the Borders, and 1,000 at OVO Energy, including at Perth, Selkirk and Glasgow. And this tidal wave might last for 3 years. I want to know if the government's ready. Can the First Minister set out what it's planning to do with this jobs emergency?
First Minister.
Look, the economic emergency that we face is colossal, just like the health emergency we've been dealing with is colossal, and we've been very clear all along that the health emergency very quickly led to an economic one, and we have been planning for that almost from the start of this. Right throughout this crisis, I've been chairing on a weekly basis a subcommittee of the Cabinet looking specifically at the economic issues. Benny Higgins has been chairing the Economic Recovery Group, and the report of that group is due to be published within the next couple of weeks, which will, I think, have important recommendations for us. I spoke to Benny Higgins earlier this week. Just as earlier this week I spoke to the Chief Executive of Rolls-Royce, I'll be speaking to the Scottish Tourist Alliance tomorrow. Increasingly, we can't take our eye off the health emergency, because if we do that, that will make the economic emergency worse. But we are also focused on the steps we need to take and the interventions we will need to put in place to support the economy, to support businesses and to support jobs. And those steps and interventions will take a multitude of forms. Of course, where the two emergencies come so closely together is that we need to keep suppressing the virus sufficiently so that we are then able to start to lift more of the lockdown measures and allow more of our businesses to start to operate and to make money again. So these are interlinked challenges, but the focus of the government, the focus of me personally, is very much on both of them.
Willie Rennie.
My fear is that the economic tidal wave is overtaking the advisory group in the work that the First Minister has just set out. This is urgent, and we need an urgent plan right now. We want to see a new government-backed job scheme, a universal basic income, capital investment in transport and energy construction, and investment in colleges and training agencies to reskill workers. So will the government back that approach? I also want to know whether the government plans to intervene to stop businesses going under. It's done that at Prestwick, Ferguson and Bifab. Will that be the approach going forward? And how will the government judge which companies and jobs it will save and which it will let go?
First Minister.
We set up the Economic Recovery Group. It's about to publish its report within a couple of weeks, I think actually probably within a week or so. I think it's right that we await its recommendations and then set out on the back of those recommendations our implementation and delivery plan, and I'm sure it will have things to say on all of the issues that Willie Rennie has raised. Second point would be around a willingness to intervene directly in companies. And Willie Rennie, I think, made my point in his question. The Scottish Government has always shown a willingness to do that where we can satisfy state aid constraints and also satisfy ourselves so that we can satisfy the public that there is a value for taxpayers' money, and we will continue to be as interventionist as we possibly can be. And there will always be difficult decisions about the circumstances in which that can be done and the circumstances in which it might not be able to be done. And we have to, all of us, have open and frank discussions about that. And there are other things, universal basic income, that Willie Rennie and I have exchanged views on in this chamber in recent weeks. I am a supporter of that. I have long been interested in the concept. I think the case for it has been immeasurably strengthened by the crisis we're living through. But this Parliament does not have the powers to introduce a universal basic income on its own, unfortunately, because so much of welfare and tax responsibilities are still reserved to Westminster. And therefore, there is a very real discussion that we also all have to engage in, whether it's about borrowing powers or tax and welfare powers, about the ability of this Parliament and whether collectively we should be coming together to make the case for additional powers to lie here to equip us better to deal with the economic challenge that lies ahead. So I hope on some of this, and I mean this sincerely, Willie, Rennie, particularly on things like UBI, will not just will the ends here, but will also join with me in willing us to have the means to deliver those ends, because that's going to be really important in the weeks and months to come.
Thank you. Question number 5, Christine Grahame.
Thank you very much, Presiding Officer. To ask the First Minister whether the Scottish Government will provide a weekly breakdown by local authority of the R number for COVID-19.
First Minister.
R is calculated for Scotland as well as for the other 3 countries of the UK, and we publish that already on a weekly basis. It's not calculated for local authorities in Scotland, as the ranges around the estimates would be very large, and it wouldn't help us understand the difference between different areas of Scotland. So instead of that, we're looking at other ways of monitoring and forecasting COVID-19 for local authority areas, and we use data and will use data such as the number of cases and hospitalisations and the information that starts to come through Test and Protect. I, along with the Deputy First Minister and the Health Secretary, took part in a lengthy session yesterday about the surveillance systems that we are building to make sure that not just at a national level but at a local level we can monitor and also, where possible, predict what is happening with this virus in the weeks and months to come.
Christine Grahame.
I thank the First Minister for her answer. I hear what the First Minister says, and I think it's important that we look at local figures for the R number, because in that way we may be able to reopen particularly the hard-pressed leisure and tourist sector, allowing them in certain areas to reopen, but as a consequence of reopening, if that can take place, monitor any change in that R figure, because hotels in my constituency, leisure activities in my constituencies elsewhere are actually going to go and collapse into liquidation if something doesn't happen soon.
First Minister.
I agree with Christine Grahame on the objective that she's encouraging here. It's simply about how we do that. The R number, even when we publish it for Scotland, there is a range, as everybody now knows. The current range is 0.7 to 0.9. The up-to-date estimate will be published tomorrow, but there is already a degree of uncertainty, and the smaller the area we try to calculate an R number for, the greater that range of uncertainty. And at local authority level, it is thought that that would then not tell us very much in a meaningful way about the differences between areas. But that doesn't mean we don't want to monitor the spread or the behaviour of the virus in different areas. We do. It's about how we do that. So we're looking at other data sources that will give us that information on an ongoing basis at regional and local authority level. So Christine Grahame is right that we need to understand it on that basis. What I'm trying to explain here is that we need to do it in different ways than simply publishing regional R numbers.
Question number 6, Jamie Greene.
Thank you. To ask the First Minister what analysis the Scottish Government has undertaken of the underrepresentation of BAME people in teaching and how it plans to address this.
First Minister.
In 2018, we acknowledged, as we of course should do, the underrepresentation of BAME people in teaching at all levels. Teaching in a Diverse Scotland by Professor Rowena Arshad, who was former head of Murray House School of Education and co-director of the Centre for Education for Racial Equality in Scotland, was published in November 2018. It contained 17 recommendations. On publication of that, the Deputy First Minister announced that by implementing the recommendations, he aimed to double the number of BAME teachers in Scottish schools by 2030. The associated working group, chaired by Professor Arshad and comprising a range of education and race equality stakeholders, is currently working with partners to implement these recommendations.
Jamie Greene.
Can I thank the First Minister for that response? Everyone needs role models in life, in politics, in media, business and education. It's disappointing that only 1.6% of teachers in Scotland are from a black or ethnic minority group, despite their percentage of the population being more than double that. In a recent survey, First Minister, nearly half of BME teachers surveyed believed that their ethnicity had been a barrier to promotion. they account for only 0.6% of teachers in promoted positions. It's vital that we identify the structural barriers that exist behind these statistics. But we must also empower teachers of all backgrounds so that they have the confidence and tools to tackle inappropriate language and behaviour in the classroom. In light of everything going on right now, First Minister, this is an area where we can and must do better. And what better way to start than by committing today to ensure that our schools, our businesses and even our Parliament look and feel more like the world outside them.
First Minister.
I wholeheartedly agree with the sentiments of that question. If I can focus on teachers first and then perhaps very briefly address it more generally. BME teachers are woefully underrepresented in our schools and in education generally. To give a little bit of context though, the numbers in Scotland's schools has increased by just over 5% in 2019 compared to 2018 and by 26.4% since 2015, but there is still so much more to do. The underrepresentation is still unacceptable, and we do know from work carried out with BME teachers that one of the key issues is a lack of diversity of role models and senior leaders in the teaching profession, which is why the recommendations that we are taking forward with the working group chaired by Professor Arshad is so important. But there is a more general issue here, and I think now is an opportunity for all of us to both recognise that and dedicate ourselves to doing more to tackle it and to tackle it more fundamentally, whether that is our schools, our businesses or this Parliament. It must look more like and be more representative of modern Scotland as it is. And as far as this Parliament is concerned, all of us as parties have a responsibility. We are now less than a year away from an election to this Parliament. And so it is for all of us. I can only in that capacity speak as leader of the SNP, but I know how determined I am to see progress on this issue. And I hope leaders of the other parties make the same commitments.
Thank you. Question number 7, Sarah Boyack.
To ask the First Minister what concerns the Scottish Government has regarding the availability of food for children in low-income families during the summer months in light of the reported rise in food poverty caused by the COVID-19 outbreak.
First Minister.
Any report that shows a rise in food insecurity is deeply concerning because everybody should be able to access the food they need, and I am acutely aware that the pandemic is affecting people in a variety of ways, including causing real financial hardship. In March, we put in place a significant package of support through the £350 million communities funding, and that included more than doubling the Scottish Welfare Fund and providing £70 million specifically to a food fund. That included £10 million to support the third sector to reach people and £30 million to local authorities to both help anyone who's unable to access food and also provide free school meal replacements. And through that, over 175,000 free school meals are being distributed. We recognise that free school meals provide a crucial support to thousands of families across the country, and the Deputy First Minister is currently considering what support should be in place to help families over the summer holiday period.
Sarah Boyack.
Thank you, First Minister. There has been a fantastic response from our local authorities and community groups, but the Trussell Trust has highlighted that there's been a huge rise in overall need compared with last year of 47% for emergency food parcels and 62% increase in parcels given to children. More than 100 organisations have called for urgent action to enable them to be fed and supported throughout the summer, with lump sum payments of at least £250 to low-income families and extending free school meal payments in cash as an alternative to vouchers or payments or parcels until normal school resumes. First Minister, there are over 20,000 children living in poverty in Edinburgh alone. So will you act on this call to support them and families with children across Scotland? And will you support our local authorities to provide vital food throughout the summer?
First Minister.
We have been doing all of that and we are determined to continue to do it. Sarah Boyack is right to point to the Trussell Trust identifying rising need and demand. But just a few days ago, the Trussell Trust also said this, that they welcomed the swift action from the Scottish Government to increase the Scottish Welfare Fund and ensure food banks can access emergency food. So the action we have taken has been right and necessary, and we intend to continue with that. As I said, the Deputy First Minister is currently considering the issue of free school meal provision over the summer holidays. We recognise the need for that, but of course we've got to consider the practicalities and how best to put that in place. But I want to give Parliament an assurance that we will continue to do everything we can to make sure that nobody is going hungry, and that we deal effectively with the issue of food insecurity, which is unacceptable even during a pandemic crisis.
Thank you. We've got a number of supplementaries. We'll start with Angela Constance, to be followed by Finlay Carson. Angela Constance.
Thank you, Presiding Officer. First Minister, Wyman Gordon is a significant employer in my constituency and is part of the Rolls-Royce supply chain. Yesterday, they announced plans to shed a third of their workforce. I'm concerned that this is merely the tip of the iceberg, given a recent Social Market Foundation report which says that the West Lothian economy could be disproportionately impacted by both coronavirus and Brexit. Therefore, what can the Scottish Government do to protect and save jobs in my constituency, and what efforts have been made to persuade the UK Government of a need for more bespoke and additional packages of support for particular industries?
First Minister.
I thank Angela Constance for raising the question. We will continue to work hard to identify the best ways in which we can support the economy generally and businesses in particular sectors. And that is going to be an ongoing challenge, but it's one that we take very seriously indeed. The implications of how we have had to deal with this virus will affect the economy for some time to come, and therefore we must continue to have support in place. We will also continue to encourage the UK Government not to prematurely withdraw any of the support that is in place, whether that is the job retention scheme or other routes of support that they have, on a very welcome way, made available. And we will certainly continue, as I hope everybody across this chamber will, seek to persuade the UK Government to have an extension to the Brexit transition period and not to countenance in any way, shape or form a no-deal Brexit. On the particular company that Angela Constance has raised, she refers to it being part of the Rolls-Royce supply chain. I referenced to Willie Rennie earlier on that I spoke to the Chief Executive of Rolls-Royce earlier this week. There is no doubt Rolls-Royce, like many companies are facing very, very challenging market conditions because of the coronavirus pandemic, but we will do everything we can to protect jobs and everything we possibly can to protect a presence in Shannon for Rolls-Royce. And of course, one of the issues that featured in that conversation was the impact of any decisions that Rolls-Royce make on the whole supply chain, and it's important we understand it in that context.
Thank you. Finlay Carson, to be followed by David Stewart.
Thank you, Presiding Officer. Across all parties, we recognise and agree that the prime objective of the Scottish Government remains to contain and suppress the virus in order to minimise the harm it can do. However, that said, does the First Minister agree that it's unfair to allow supermarkets and department stores like Marks and Spencer's to sell food on one floor, but also non-essential goods such as clothing on others, or Wilkinson's or Dunelm to sell duvets and rugs when local family businesses selling the same products cannot? Will the First Minister agree to re-examine the case for independent retail businesses to open in phase 2 if they can adhere to the social distancing guidelines and if only opening 800 square metres of floor space to the public on each floor?
First Minister.
Well, that is and will be under consideration as we go into the next phases of the exit from lockdown. But it is important, and Finlay Carson and I appreciate this, recognise that we must get the pace of this right. I wish we could open up the economy completely tomorrow, but if we get the pace wrong, we will either have to turn back on plans or we will end up seeing the virus run out of control and we will be back in lockdown, and that will not help the economy. There will always appear to be anomalies in what we're doing, but there are some complex considerations. We have to consider overall footfall in terms of retail. There is also a difference, of course, between people buying essential things like food and non-essential things in the judgment that we make about whether it is absolutely necessary. Closed shops, of course, you have issues about you're trying things. So there are a whole range of considerations we have to take account of. But we are discussing with all sectors and we want to open up as quickly as possible. But it has to be safe and it has to be sustainable. And the sustainability point is important here. We are going to be living with this virus for some time to come, and therefore every step we take, we have to make sure that we're taking it on as firm a footing as possible, so that we're not moving in one direction at a particular pace that ends up setting us back. And these are difficult judgments, and we will continue to make them to the best of our ability, trying to minimise all of the various harms that this virus is doing. And a week tomorrow, of course, we will set out our judgment based on the most up-to-date evidence of whether we go into phase 2 of the route map, and if we are going into phase 2, to what extent we're able to do that. And I will make a statement in Parliament next Thursday setting out the conclusions of that consideration.
David Stewart, to be followed by Kenneth Gibson.
Thank you, Presiding Officer. The First Minister will be well aware that to conquer COVID-19 requires scientific collaboration, initiative and innovation. Will the First Minister join with me in congratulating my constituent Pete Gavin from Highlands and Islands in his work, highlighting the positive role that negative ion ionisers can play in fighting the virus, preventing infection and setting Scotland back on the road to recovery?
First Minister.
Yes, I will congratulate Pete Gavin for the work he's doing. I think that we should all, in circumstances none of us would have chosen to be in, should take great pride in the way that Scottish scientists are at the cutting edge of the global efforts to both understand COVID-19 and also find ways of tackling it. And that's true in terms of the trials to hopefully develop a vaccine. It's true in terms of some of the scientific work that was reported on yesterday about genome sequencing of the different lineages of the virus to help us understand more about how it spreads and transmits. So in a whole range of different ways, Scottish scientists are leading that work in partnership and collaboration with scientists from across the UK and indeed globally. So it's, I think, right and proper that we draw attention to that. And it's probably right and proper as well that I note that Dave Stewart announced his own retirement from this Parliament this week. And I'm sure we'll get opportunities in the future, but I'll take the opportunity right now to wish him well and thank him for the contribution that he makes.
Kenneth Gibson, to be followed by Alex Kroll-Hamilton.
Thanks, and you were sadly missed, David. First Minister, yesterday I was contacted by a shielded constituent with cancer who has self-isolated for 12 weeks. In her mid-70s, her dearest wishes to see her grandchildren, yet now she faces an additional 6 weeks of isolation and is torn between following guidance or seeing her grandchildren, possibly for the last time. Surely by staying outdoors and maintaining social distancing while visiting loved ones, the infection risk is minimal. Can the First Minister explain the criteria for ending my constituents' isolation and others in similar situations? No new cases for a week, a month, locally, nationally. People need to know there is hope and light at the end of the tunnel.
First Minister.
I absolutely sympathise with the sentiment of that question. I can only imagine, because I don't have direct experience of how it feels to be in the shielded group right now, how it has felt for the past number of weeks and how it feels to face more weeks of advice to continue to shield. I have a member of my own family in the shielded category, and therefore I do see some of the impacts of that. This is guidance and advice that we are giving for the protection of people in the shielded group, not because we want to keep them in isolation for any longer than is necessary, but because we know the risks of this virus to those in the shielded groups is significantly higher than it is for the rest of us. The risk of becoming very seriously unwell and, frankly, the risk of dying is considerably higher. So it is guidance for people's own protection. And I hope people, whatever the frustrations they understandably feel, will understand that. We hope next week to be able to amend that guidance to allow people to go outside for exercise, albeit they will still be advised to stay 2 metres distant and also not to mix with other households. We have a clinical cell that gives us advice on the shielded group, and so all of these recommendations are based on that advice. Over the period from now until the 31st of July, we want to move whatever, not on the basis that Kerry Gibson said of a certain level of virus, but we want to move to a situation where we are able to give much more tailored advice to individuals that will take account of their specific condition, that will also take account of their age and ethnicity and other relevant factors that will enable them to have a conversation with their own clinicians about the level of risk that they feel able to take, how to manage and mitigate that risk and what support is in place for them. And a key part of of that will be to, and this is where Test and Protect and our wider surveillance system, going back to Christine Graham's question, is very important, because that will also involve the provision of data to individuals about the risk and how that risk is changing in terms of the prevalence of the virus in their own local areas. So we want to get to that position as quickly as possible, but we need to base that on the soundest possible scientific and clinical evidence, and that's why it is taking and will take a bit of time to do that. And all nations of the UK are going through similar processes right now. But I just want to end by saying to everybody in the shielded category, we are not forgetting about you, and we are acutely aware of how difficult this is for you, and want to move to ease this guidance on an ongoing basis as much as we can. But in terms of that backstop, by the end of July at the latest, have a much better position for you, where you can base your judgments about how you live your life on better evidence and much more nuanced evidence.
Alex Cole-Hamilton, to be followed by Emma Harper.
Thank you very much, Presiding Officer. The Royal Zoological Society of Scotland have signalled that if they cannot open Edinburgh Zoo by the end of the month, it may face closure, threatening 300 jobs in my constituency. Even with furlough, they face a burn rate of £700,000 every month they stay shut. They've adapted the zoo to operate safely on an outdoors basis with adequate social distancing, and if allowed to open now, they can see a pathway to recovery. So can I ask the First Minister, given that the UK government will allow English zoos to open from Monday, will she listen to over 3,000 people who've now signed my petition and allow Scottish zoos to open their doors now before they face collapse?
First Minister.
Look, as will be the case on every instance and example and illustration that is given, I have nothing but sympathy for the position that organisations like Edinburgh Zoo find themselves in. And I want to be in a position where we can signal reopening to organisations like that as quickly as possible. But we have to do this in a careful and properly assessed way. We cannot start to take individual decisions based on particular circumstances in particular organisations. Not because we don't desperately want to do what organisations like Edinburgh Zoo are asking, but because if we start to operate like that, we will end up in a mess. The virus may run out of control and we'll have to reverse some of these things. Now, each government has to take these decisions based on its own advice and based on its own judgment. But it's only a few weeks ago that I was being asked why weren't we following a similar timetable to England on school reopening. And yet now we see a reversal of that timetable. So we need to do things on a measured and carefully assessed way, because that means not only will we be able to get places open more quickly, but we hopefully will be able to have them opening in a way where they're not faced with having to close again in a few weeks' time. And this is a really careful series of decisions. And I've said all along, this is not a popularity contest. It's about trying to get it right. And that's what I'm going to continue to strive to do.
Emma Harper, to be followed by Liz Smith. Emma Harper.
First Minister, carers make an invaluable but often unrecognised contribution to society. The impact of COVID-19 will have meant carers are under more strain than ever, with less free time. How is the Scottish Government ensuring that young carers in particular can access opportunities available to their peers during this difficult time?
First Minister.
Well, young carers do make an incredible difference to the lives of people they care for. Sorry, Presiding Officer, I'm being very distracted by some chat in the background here. Young carers are making an incredible difference day in and day out, and I want to put on record my gratitude and the gratitude of the Scottish Government to them during Carers Week, but also for the work and the contribution they make every single week of the year. The Health Secretary announced at the weekend some additional funding to reach as many young carers as possible and provide them with extra support during this time. That funding is going to Young Scot and the Time to Live Fund, and it will allow young carers to access opportunities such as e-vouchers and subscription packages, as well as small grants to help them take a break from caring. And of course, that's on top of our existing Young Carer Grant, which is a £305 payment for those aged 16 to 18 with significant caring responsibilities. But I want to emphasise today my gratitude, and I'm sure the gratitude of everybody across Scotland, for all of the contribution that young carers make.
Liz Smith, to be followed by Monica Lennon.
Thank you. Could I ask the First Minister, in light of the answer that she provided to Willie Rennie earlier, what specific support can she offer to the Crieff Hydro Hotel Group in light of the news earlier this week that there will be substantial redundancies in what is obviously a major chain of hotels for the Scottish tourism sector at the time that will be the height of the tourist season?
First Minister.
Well, as I said, we'll talk to the Scottish Tourism Alliance tomorrow, but more immediately than that, and perhaps even more relevantly, the Tourism Minister will make a statement in Parliament this afternoon. One of the key things we have to do, obviously I'm not going to cover the ground that Fergus Ewing will cover later on, but one of the key things we want to try to do within all of the uncertainties we face right now is give as much clarity as possible to the tourism sector, to the hospitality sector, of when they can start to plan to reopen, albeit in a safe and perhaps different way to how they normally operate. But Fergus Ewing will cover that this afternoon, and I hope that will be welcomed by the sector, albeit that it has to be caveated right now in the way that I do, which is it's all dependent on us continuing to suppress this virus in the way that we are currently doing.
Monica Lennon to be followed by Gillian Martin. Monica Lennon.
Thank you, Presiding Officer. First Minister, it's been reported in the Daily Record today that according to NHS Lanarkshire board papers, it is suspected that almost 100 patients and staff contracted COVID in non-COVID parts of hospitals, and sadly a fifth of those patients later died. Following my questions to the Health Secretary in recent weeks, including yesterday, I've had a lot of families get in touch with me in my own parliamentary region. And the particular question I want to ask for now is that do any of these figures include patients who had recently been discharged from hospital and died at home and in the community? And in particular, is that something that the nosocomial working group is looking at in terms of recent discharges, and how can families who want to raise concerns and have questions get in touch with the nosocomial working group?
First Minister.
Well, as I said earlier on, the unvalidated statistics that the Health Secretary has shared with Parliament are unvalidated, and that means it is not safe or responsible for any of us to draw firm conclusions from them until they are validated. So the work to really understand the extent to which infections that have been either in patients diagnosed in hospital, whether or not the patient sadly went on to die, and whether infections in staff who work in hospitals and have perhaps been working with COVID patients, whether or not these were actually acquired in hospital or were acquired in the community, that is work that still has to be understood. As I've said earlier on, that work we hope will be completed by the end of this month, and then it will be published for not just Parliament but for members of the public, including families who've had this direct experience to look at. And I think until we have that validated work, I would simply say to all members to be a little bit cautious about drawing firm conclusions from it at this stage.
Gillian Martin to be followed by Alexander Stewart.
Thank you, Presiding Officer. In light of recent reports that the UK Government is preparing to relax food safety standards in order to secure a trade deal with the USA, does the First Minister feel that this, that this would have a detrimental impact on public health?
First Minister.
I would certainly encourage the UK Government to stick to its commitment to uphold the highest standards in future trade negotiations. Recent reports suggest that this position may well be compromised in the US discussions, and we are very concerned that the UK Government's response to these reports is referred only to food safety, which, while important, doesn't alone guarantee that other standards will not be undermined. It goes without saying, I think, that any future trade deals mustn't endanger public health in Scotland or lower food safety standards from their current level. The ability of Scottish authorities to implement measures to protect public health and consumer confidence mustn't be compromised, and Scottish ministers must have the independent ability to impose import restrictions for the purpose of protecting the health of the public in Scotland based on any advice we receive from Food Standards Scotland.
Alexander Stewart to be followed by Mike Rumbles. Alexander Stewart.
Thank you, Presiding Officer. First Minister, the scale of the crisis engulfing the National Trust for Scotland is becoming ever clearer. Hundreds of staff have been warned that they could face redundancy after the pandemic wreaked havoc on this year's tourist season. Some trust sites in my own region will not open their doors until 2021 or even 2022. Therefore, what action will the Scottish Government put in place to ensure that this organisation continues to support the heritage of Scotland for future generations?
First Minister.
Well, as I said in the Chamber, I think just 2 or 3 weeks ago, the National Trust for Scotland is a hugely important part, not just of our tourist economy, but also our reputation and brand as a country. So we are in contact with the National Trust and will continue to be so to support them through and beyond this crisis. Part of that, of course, is as quickly as possible, but as safely as necessary, we allow parts of our economy and our tourist economy to open up again and get back as quickly as we can to a position where we're encouraging people to visit these kinds of places, and in the meantime make sure that we are working with organisations to help them deal with the immediate challenges. None of these things are easy, none of them have easy answers, but we have to continue to work through the health impacts and the economic impacts in a methodical and systematic way, so that the recovery we are building is a safe and sustainable one, and that's what has all of our focus at the moment.
Mike Rumbles, to be followed by Sandra White.
Thank you, Presiding Officer. On the 6th of May, I asked the First Minister why she wasn't following the advice of the World Health Organization, who recommended as safe a 1 metre social distance, not a minimum of 2 metres. In her reply, it seemed to me that the First Minister wasn't aware of the World Health Organization's recommendation when she simply pointed out that some other countries had different social distances than ours. Could I ask the First Minister again? Should she not be following the science as recommended by the World Health Organization and recognise that a 1 metre social distance is a safe distance?
First Minister.
I can assure Mike Rumbles that I'm well aware of WHO recommendations, and it's not a competition, but I'm prepared to bet I've probably read much more about this than many other people across Scotland has in recent times. To state it as bluntly as that, I think, to be perfectly frank, does a disservice to the issue. Different countries use different distances. If Mike Rumbles wants to listen, I'm actually going to try to be helpful to him here. Some countries use a metre, some countries use 1.5 metres, some countries like the UK advise 2 metres. Now, let me say very clearly, because frequently I get asked why am I not following this advice or that advice. All of the advice I have had here in Scotland at this stage says to me that we should not change the 2 metres. And the reason for that is that it is not a simple equation. It's and if you read, as I'm sure Mike Rumbles had since he's asking me this, the research that was part funded by the WHO and published in The Lancet last week, it makes this point that as you reduce the distance, you do increase the risk of transmission. And there's also a relationship between the distance and the time that it is then safe for people to be in contact. So right now, 2 metres for 15 minutes or more is what we advise. If we reduce that distance, then we may also have to reduce the time. And some countries that have a shorter distance also have different requirements in terms of face masks and face coverings, which of course we are currently looking at whether we want to make face coverings mandatory. So all I'd say to Mike Rumbles is that these are not straightforward or simple equations. We have to take a very careful analysis. And right now, all of the advice I have at my disposal from our own advisors says that we shouldn't reduce the 2 metres rule. But we will continue to look at that, and in the context of everything else we do, we will continue to make judgments that are safe in terms of the suppression and the transmission of the virus and allow our economy to operate as close to normal as possible. But I will not depart from, in any aspect of this, as far as I possibly can, a careful and methodical consideration of all of these issues. Because when we get these things wrong, Presiding Officer, and Mike Rumbles this is not a criticism, legitimately would be one of the first ones standing up to criticise me for getting these things wrong. On a virus, if we get these things wrong, people can die, and that's why I'm not prepared to be reckless about any of it.
And Sandra White.
Thank you very much, Presiding Officer. First Minister, alcohol has always played a part in most of our lives, and it has had a huge impact. Can I therefore ask the First Minister what her response is to the latest report by Public Health Scotland on the impact of minimum pricing?
First Minister.
I very much welcome the latest report from Public Health Scotland that continues to demonstrate that minimum pricing for alcohol is having an impact in reducing the amount of alcohol that is sold and consumed across Scotland. And the 4 to 5% finding of Public Health Scotland this week is very welcome. We will properly and fully review the impact of minimum pricing when we are due to do so, and that's required under the legislation. But all of the indications so far is that this is a policy that is having the desired effect, and as somebody who took the legislation through Parliament and has and worked for many years to deliver this policy, it's something that I am very, very pleased about and very committed to continuing to see have that positive effect. We all know that while Sandra White is right, alcohol plays a role in many of our lives, and as long as it's we drink it responsibly, that is fine. But the unhealthy relationship with alcohol that too many of us in Scotland have had over many years, it does a lot of damage, and getting that under control is really positive for the future of our country.
Thank you very much. Apologies to the members I wasn't able to call, but I'm going to conclude First Minister's questions there. However, I've been given advance notice of a point of order from Gail Ross. Gail Ross.
Thank you, Presiding Officer, for taking my point of order. Last week, Alex Cole-Hamilton asked the Health Secretary about COVID-19 in care homes. He told the Chamber that he has a constituent whose daughter works in a care home in the north of Scotland who had processed the arrival of a resident from Home Farm Care Home on Skye, who subsequently died within a week from COVID-19. Now, although he did not name the care home in question, it was then printed in the media. The article has since been retracted and an apology issued because this allegation has proved to be completely false. It's essential that we as elected members are completely sure and certain of our facts when we speak, and this is a case in point. Now, Alex Cole-Hamilton has apologised on social media, but I would like to take this opportunity to correct the official report, to ask him to apologise to the Chamber, but more importantly, to apologise to my constituents, because this has caused a huge amount of hurt, worry and anger, and has left a lot of people asking, how could he get it so wrong, Presiding Officer?
Thank you, Ms Ross. The point that Ms Ross makes is noted. However, it's not a point of order for me to rule on. Matters of accuracy are matters for the members themselves to address. Alex Cole-Hamilton.
Thank you, Presiding Officer. I'm very grateful to Gail Ross for bringing this to the attention of the Chamber. I was wrong on this situation, on the facts. I apologise on social media, and I'm quite happy to take the opportunity to apologise to the Parliament and to anyone affected by my remarks. I should have checked the facts more substantially, and I will learn from this and moving forward. Thank you.
Thank you very much, Mr Cole-Hamilton. Thank you very much. I think that addresses the point satisfactorily. Thank you, Ms Ross. And that concludes First Minister's questions. Parliament will be suspended until 2:30 when we resume with a ministerial statement on tourism. We are suspended.
How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe and
1973, and I remember how much of a razor's edge that was balanced on. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
About the work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.